Hello and welcome to our webinar on the impact of COVID-19 on K-12 education and childcare. This is the seventh in a series of webinars aimed at cities and regions in the post-coronavirus era, initiating community conversations on what lessons we can learn from this crisis to create a more resilient and sustainable world. My name is Katie Phillips, and I am the Outreach Coordinator at the Center for Urban and Regional Analysis, otherwise known as CURA. I will be your host for this event. If you require closed captioning, you will find a box at the bottom of the screen called CC or closed captioning. Click on the box and select Show Subtitles. This will allow you to see the subtitles during the presentation. If you are having trouble viewing the subtitles in the Zoom webinar platform, you can use the Stream Text alternative link I will provide in the chat soon. Please feel free to submit questions at any time during the webinar in the Q&A box. We will ask as many of your questions as we can in the last portion of the panel discussion, and if we do not get to your question, we apologize. If you have any additional questions following this event, please feel free to email me at phillips.1870@osu.edu. There will also be a short survey at the end of the webinar. If you have time, please provide your feedback. I am now going to kick it over to the moderator for this event, CURA's Director, Harvey Miller.
Okay, thank you, Katie, and thank you all of us for joining us today in the seventh of our series on cities and regions in the post-coronavirus era. We initiated this back in the spring during the coronavirus initial stages of it, in order to have a conversation involving community leaders, OSU faculty and researchers, and you surrounding issues, looking at the coronavirus and how it's going to impact Central Ohio and cities everywhere. So on Monday, November 30th will be the last in this series, and that'll be Economic Impact of COVID-19 on Communities Part 2. This is a follow-up to an economic panel we had back in June, and we're going to ask the same panelists, well, where are we now? And those panelists will be Bill Lafayette, the owner of Regionomics, Jennifer Clark, who's section head of city regional planning at The Ohio State University, and Eddie Pauline, who's director for business development, economic and corporate engagement at the Office of Corporate Engagement at The Ohio State University. So that will be Monday, November 30th, same time at noon, a special time because of the scheduling. If you can't make it, still sign up for the webinar and we'll send you a link and you can watch it later at your leisure. As always, go to cura.osu.edu and sign up for our newsletter. You'll never miss any of these events. Also, like us on Facebook, follow us on Twitter and Instagram. So we'll start with today's panel, which is the impact on K-12 education and childcare. And we have a first-rate panel here today. I'll introduce all three panelists. We have Dr. Talisa Dixon, who's in her second year as a superintendent CEO of Columbus City Schools. She began her tenure in March 2019 after 5 years leading the Cleveland Heights, University Heights City School District in Northeast Ohio. Dr. Dixon previously spent 9 years as administrator in Columbus City Schools from 2001 to 2010. She served 6 years combined as the principal of Brookhaven High School and at Columbus Alternative High School. Dr. Dixon received her Bachelor of Arts in Sociology from Mississippi Valley State University and has 3 Masters of Arts degrees. That's impressive. Sociology education and secondary education from the University of Akron, and also a doctorate in education from the University of Akron. Thanks for joining us, Talisa. Our next panelist will be Jamie O'Leary. She is the Associate Director for Policy at the Crane Center for Early Childhood Research Policy at The Ohio State University. In this role, she translates early childhood research for policy leaders and manages relationships with elected officials and other decision makers and advocates. Jamie has worked in education policy and advocacy for over a decade, starting her career as a public school teacher in Camden, New Jersey, after studying politics and international relations. She earned her master's degree in public affairs from Princeton University School of Public Affairs in 2009. Jamie is a former Teach for America Corps member, a Truman Fellow in 2005, and a first-generation college graduate committed to equity for all children. Thanks for joining us, Jamie. And finally, Dr. Eric Karolak. He is the Chief Executive Officer of Action for Children. the Child Care Resource and Referral Agency for Central Ohio. AFC provides home visiting and parenting services, professional development for early childhood educators, and quality improvement coaching to childcare programs. Each year, its programs reach more than 50,000 children and 9,000 adults in Franklin and surrounding counties. Previously, he directed an advocacy alliance of more than 8,000 early learning programs, enrolling nearly 1 million children across the United States. And before that, the federal government's largest early childhood technical assistance center. He has been an expert witness before both houses of Congress and a half dozen state legislatures. Eric, thank you for joining us today. So what we'll do is we'll start with opening statements from all three panelists, and we'll start with Dr. Dixon, please.
Well, thank you for inviting me for this very important conversation. For us in the K-12 space, I would like to kind of talk about just briefly three pieces: that collective impact of the community. I think what the community, Columbus community, has shown recently, the support that they have provided for our schools shows that the walls of K-12 spaces in the public sector are done. And we have to cross those lines and show support for our schools and our families. And there's also been a shift in education and technology. The way that we're teaching and the way the students learning, we're going to have to make that shift. And I think that's one that's been welcomed and needed, and that shift is happening. And then the third thing, I think that shift is talking about those basic needs for our students, okay? And I talked about before that we have to get away from that Bloom's taxonomy to more of Maslow's hierarchy of needs. What do our students really need and our families need during this time? And then lastly, the policy and funding implications. And for our K-12 space, we've seen a lot of changes. And there's a school funding webinar, a session that's happening right now as we speak. So those are three areas that I think are very unique and that we're paying a close attention to in our K-12 space.
Okay, thank you. And now we'll continue with Dr. Karolak.
Thank you, Harvey, and everyone for including Action for Children and early childhood education as well. You know, child care and early learning are the beginning of the education continuum. I like to say that free public education is the bedrock of American democracy. And unfortunately, our education system actually begins before K-12 in a largely private market-based system. And that's really important also for understanding how COVID impacts childcare differently, perhaps, than early childhood, than K-12 education. One thing that is significant is that when childcare is closed, as happened in March and April of this year, closed to only families of essential workers, it meant that businesses were closed, that we estimate over 10,000 employees without work. And that in childcare means without pay, because again, it is a private market-based activity. The largest funder of childcare and early learning in the United States are families. And so the impact of losing that sector, even for a brief period of time, is quite significant. In COVID, childcare is facing it's always had pressures, whether it's about workforce or about the financing, but under the pandemic, those pressures have sort of escalated and it's facing really a fundamental math problem. Enrollment is depressed, whether because of regulation or because of families' reticence to send their children out of the home. Enrollment is depressed. Costs of operating, though, are up. You can think of PPE and other kinds of conditions that raise the costs of childcare. And that means that programs, again, privately funded programs, are operating increasingly at a loss. We are fast approaching, even here in Central Ohio, a make or break moment for childcare. Our data shows that nearly one out of four childcare providers in our region is not sure that they will be able to stay open more than 3 months. And those that are operating at a loss. More than 2/3 record a loss. And for our sector, one of the crucial issues is around workforce. 1 in 3 report that they are challenged in meeting the needs of their workforce. And we estimate that there are approaching around 750 or more open positions in the childcare sector just in our local community. This is a serious problem in Columbus and Central Ohio, but it's a national problem in nature. All across the country, the privately funded basis of childcare and early learning is revealing the weakness of not investing in early childhood education the way we do in K-12 as a public good.
Okay, thank you. Finally, Ms. O'Leary, please.
Yes, thank you so much. It's great to be with you all this morning. I'd like to bring up 3 broad ideas. These are sort of 3 things I think are really important to understand and address if we have any hope of mitigating what are certainly going to be long-term effects from this pandemic on children and their families. So the first is about stress. Fundamentally, the past 8 months have created incredible stressors on children and their caregivers. The American Psychological Association said that parents are much more stressed than non-parents right now, with a growing body of evidence showing that parental stress really affects kids. And we also know that those experiencing financial distress are experiencing this even worse. So they're not just afraid of COVID or getting the virus, but they're afraid of not being able to clothe and feed their kids. Some of my colleagues at the Crane Center surveyed families in Central Ohio at the outset of the pandemic to find out more about their experiences and their stressors. They published a paper on it. So this was led by Dr. Cami Schmier, who's a sociologist and demographer at OSU. And their findings some of them were surprising and some of them not surprising. They found that 1 in 4 families began using food pantries or food stamps for the first time. 15% reported they didn't have enough money for food. More than a half of caregivers said that they were experiencing mild to severe anxiety. Almost 4 in 10 experiencing depression. The mental health pandemic is sort of its own animal, and these stresses are coming at a time when we're experiencing disruption to social networks and circles of support. And so 1/5 of those caregivers reported losing contact with family and friends, and it was even worse for children. 40% lost regular contact with their family and friends. And so those buffering factors that help kids and families get through stress also are taking a hit. We're living in high stress times. I mean, that much is obvious. The amount of collective trauma, not just with COVID. I know this is a webinar about COVID, but with racism, with wildfires, with civil unrest, very fraught political times, which I'm sure I don't need to remind you about today. But I say all that not to be doomsday, but to underscore that these are the realities facing children and the world that they're growing up in. And these are the realities that are facing parents who are trying to do right by kids, which is becoming increasingly difficult, especially for those living in poverty. So I think it's worth really treating stress as a lens unto itself and asking ourselves how we can create more policies and programs whose core functions are to minimize stress for children and families. The second thing is that I think we have rare appreciation and goodwill. The crisis has brought forward, I think, a rare opportunity because overnight millions of parents became their children's teachers. I think a lot of people who otherwise wouldn't realize or maybe forgot the hard work that is teaching were reminded of this in a really personal way. And the same is true for childcare programs. I think folks had to, wake up every day and figure out what they were doing with their kids. They realized how important it is to have high quality, reliable childcare, not just so that they could go to work. And that's important. It's important to keep the economy moving, but also because centers and home programs provide places where children can thrive, where they can practice social and emotional skills, where they can engage in rich conversations with adults and their peers and lay all of those complex neural pathways, which sets them up for success in literacy and learning and kindergarten. So none of that work is easy for early educators. It's never been easy. And I guess if COVID is what it took for us to really understand that in a firsthand way, then that's a silver lining. The downside is that the appreciation and goodwill is also happening at a time when we're experiencing a lot of financial cuts, which brings me to my final point. We need more money. We need to invest more in early childhood, ages 0 to 5, and even more specifically, ages 0 to 3, when we know most brain development is happening. But superseding all of that, I think we need a fundamental shift in how we treat early childhood as essential in the business of education and learning. We need a shift that's cultural, that's political, that goes sort of beyond these spaces where we recognize this already. And I don't think we can achieve those policies or those funding structures without that mindset shift. To borrow from two legislators in Ohio, the co-chairs of the Legislative Children's Caucus, Peggy Lehner and Allison Russo, they spoke with us and talked a lot about the need for more male champions of this issue. Investing in children is not a women's issue. It's a societal issue. It's an economic issue. And so I think we need to really look hard at some of these longstanding philosophical beliefs about what it means to care for and educate young children, and whose responsibility that is.
Okay, thank you. Thank you, panelists. You've raised some big concerns and big issues, which we're going to drill down into now. So let's talk a little bit more about COVID-19 and how it's impacted childcare and education. Let's talk about the negative aspects, some of the positive aspects, and some of the challenges. So we'll start with you, Talisa. What are you seeing at Columbus City Schools?
Thank you. Well, one of the couple main challenges. One is getting just a handle on our student attendance. So just a reminder, we've not been in session with all of our students since March. We now, as of Monday, we brought in 1,500 of our career and technical education students who are now in blended format, but we've not seen the majority of our students since March. So the question of, are those students engaged? And if they're not, why aren't they? Where are they? So that is a big concern to us. We've now narrowed that number down to 1,000 students now that we are calling that are disengaged, and that we have a strategy around locating those students and contacting those families to see exactly what is it they need. Is it technology? Is it a hotspot? Is it some other resources for the families? We understand that, now we have a lot of families are, unfortunately, they're homeless. So there's been a lot of evictions throughout the city. So we know that our families need so much more now, and it's impacting our students' ability to be engaged in school. So that is a negative impact. A positive impact has been back in last year, we had talked about the district moving to a one-to-one computer initiative. We've had to change that and really elevate our opportunities to provide technology for all of our students and using technology as a lever. And so we have about 25,000 new Chromebooks that were gifted to us. And we've had teachers a lot of creative teachers who wanted to use technology as a lever for engaging students. And we've been seeing a lot of positive results with that. And finally, one of the challenges that we are having, again, is how do we ensure that our students are fully engaged in that learning? We know that they're on the Zoom meetings, they are doing their assignments, but not being able to be face-to-face with our students, because we know that in the classroom is the best place to learn. We're still challenged with how to continue to improve that. And then once all of this crisis is over, we still want to be able to use technology as a lever in our classrooms in a very creative way. So those are just three pieces of how COVID is impacting our organization.
Okay, thanks. So Eric, you talked about childcare in your opening remarks. Can you tell us more about the good, bad, and the ugly of what's going on in that domain?
Good, bad, ugly. I'll just keep it to two flip sides. One thing I'd emphasize is around resourcing. It's always been difficult to make ends meet in childcare. And I mentioned in the opening about the data we have on the inability of programs to bring in revenue that covers expenses. But in the time of pandemic, that also is more challenging just as we've all at home at different times experiencing difficulty with the supply chain, it's only that much more so for childcare providers. During the summer, I remember visiting with providers who were teaming up in a Suburban to go drive from store to store to buy up what was permissible at each store of various supplies. Family childcare providers, who are about a fifth of our total providers, play a very important role for providing care in non-traditional hours. They aren't so easily able to step away from, they are their job, their center is their home. And so it's even more difficult when the hours they're able to do this are limited. More recently, it seems that materials have become more available. So centers have been doing better since summer, although I've just heard in the last week additional problems, more so specifically around PPE. And so real difficulty, and it keeps their focus on the real issue at hand, which is the care and development of young children. But on the other side, the positive of this is that the genie is kind of out of the bottle around the importance of childcare. Jamie alluded to this, that childcare is essential. May not look like surgery, but it is essential for the functioning of our community, of our businesses, our society, in the same kind of way that education is an essential. We can't do without education as a society over any period of time. And so I think that gives me a lot of hope about the possibility of bringing about those changes Jamie ended her remarks with. Big thinking to address what is essentially a fundamental core problem that every family deals with: what to do with your young children while you're trying to make a living and while you are trying to build a future that requires them to have the skills, the tools, the disposition necessary to be successful in our economy.
It's a good segue to you, Jamie. Tell us about what you're seeing and when you look at the research and working with policy makers and decision makers in the communities. What's happening?
Yeah, well, I think the positive is something I mentioned in my intro around this renewed appreciation for the work, the complex work that our teachers do, no matter what level, K-12 or early childhood. And the research supports that really strong relationships between teachers and young children. The rich language exchanges really are setting children up for success in literacy and in kindergarten. And it's not babysitting, and it's not, I think there are a lot of misconceptions about what it takes to do well. And right now, I think that's coming more and more into the spotlight. And as Dr. Carolock said, we're really recognizing the importance of care. I know the algorithms probably have me figured out already, but the number of headlines I see every day about childcare, I can never recall that happening as much as it's happening now, which is a good thing. It's more and more on people's minds. I also think that there's a new focus on parents, especially in a hybrid and a virtual reality. They're playing an increasingly important role as facilitators of their children's learning. And so there are more conversations being had about what it takes to support them to do that work well. The negative, as I mentioned, I think are the stressors, and even more than that, the inequity of all of this. I have two young kids, ages 5 and 7. And every time I think that it's hard for me to juggle work and schooling and life, I think about the children who are logging into remote learning from a domestic violence shelter or a homeless shelter, or the families that are driving to parking lots to access Wi-Fi, or struggling with basic food needs. And so these inequities are truly staggering. And I think we can't forget to keep that front and center as we're talking about these long-term impacts.
Yes, indeed. So let's talk about what's been done since March 2020. Have there been any new policies or protocols developed? What about in the Columbus City Schools, Talisa?
Yeah, there've been, we've received a lot of waivers for food service. We actually have changed our food service programs now that we are providing hot meals daily. We had initially started providing 7-day take-home meals for our families. They could pick up on Wednesday. They have those for 7 days. But many of our families didn't like that they wanted daily hot meals and the option of taking meals home. So we modified that program. And so this week we decided that families can come, or students rather, 18 and under can come every day, pick up a hot meal and a breakfast for the next day. And then they can also take food home for the weekends. And we are also looking at what that will look like for Thanksgiving and Christmas. So this is very different than what we've done before. And we are fortunate that some of these waivers that that the federal government has allowed us to be able to provide that for our families. Also, we've had waivers for that we're able to families to get EBT, electronic benefit funds. So again, we wanted to, goes back to what I stated earlier about that Maslow hierarchy of needs. How do we make sure that families have their basic needs met? And that comes before many cases teaching and learning. If families don't have basic needs met, then it'd be very difficult for our students to learn. We know many times that students come to school hungry and they want that, that nutritious breakfast. And now we are challenged with, what are our students eating in the evening? Are they having a good nutritious lunch? So being able to stretch ourselves and think differently about how do we provide these needs for our families, the policies and waivers have allowed that. And also the last thing is testing. Testing, good, bad, or indifferent is something that that school districts or states use to show if schools are doing are teaching the standards. And so in the spring, we received waivers from all of those state testings. This fall, we've not received any waivers. They've extended the windows of the testing windows for some of our assessments, but in spring, all those tests were waived. So we are anticipating some future waivers from some tests moving forward. And then licensure provision. So teachers and others who had to renew their license this year, they had extended time to get that done. So there have been some provisions, there have been some policies. And the last thing is CARES Act funds to give us funding for the PPE. We're the largest school district in the state. So just think about the amount of PPE, the plexiglass, the wipes, all of those things that we have to have in our schools. And we're committed to having at least a 90-day supply in all of our buildings. And we have 109 school buildings. So there are fundings for that, the many waivers that we are appreciative of, but we know that it's going to cost us more money to keep these supplies on hand and to make sure that our schools are safe and clean for our students and staff.
Okay, good. So Eric, what are you seeing in your area in childcare around Central? Are you seeing some innovative policies and procedures?
Yeah, much of the funding and policy landscape for childcare is really set at the federal and the state level, but we have really benefited from forward-thinking leadership at the state and local level, whether it's in the governor's office, the office of the mayor, the county commissioners, city council, in prioritizing some of those CARES Act dollars that Dr. Dixon mentioned for childcare. When childcare was closed, you understand the financial impact of that, but even when it reopened, that depressed enrollment made it very difficult for programs to stay open. And so the state created a pandemic support payment program by which it was able to move $60 million in less than about 3 months throughout the summer. And on top of that, or in addition to that, the state also paid, during the program closure period, paid for the slots, the seats in childcare programs that low-income children who met the eligibility requirements of the publicly funded childcare program would have been using. So there was some significant investment at the state level. And then our local leaders also decided that childcare deserved some special attention. And so they used part of the CARES Act funding available here in the county, Franklin County, and for Columbus, America's 14th largest city, to prioritize a recovery and stabilization grant to child care providers in selected zip codes and then throughout Franklin County. I'm sure that those dollars have staved off what we are seeing in other states, including nearby states, where the rate of closure is that much greater. And but unfortunately, the CARES Act money it's coming to an end. Essentially, it's ended this month. And so the problem is just sort of postponed for a period of time. But that prioritization was really crucial. Another change that the state made is it postponed the deadline for its quality rating and improvement system from July to September. Remember the buyer beware in the childcare early learning marketplace. The state, like almost all states, had created a way to rate and help providers improve the level of their service called Step Up to Quality. And all programs that participate in publicly funded childcare or receive any publicly funded dollars, including Columbus City Schools preschool programs, all had to meet that Step Up requirement. The state pushed it off to September the 1st. No region was able to make that July 1st deadline. So that was a really important move that was made. But in fact, everyone was able to meet the deadline by September the 1st. So that was a huge win for all concerned. There were some other things as well. The creation of temporary pandemic licenses. Currently, we still have one operating for school age care that would make it a little easier for childcare programs to serve young children who were in virtual learning arrangements. And also changes to the rules around how you paid for various hours. So at the federal level, an issue was that you could not use childcare money to pay for time when school was in session, which makes perfect sense when school is in person in session. But in a pandemic era with virtual and hybrid arrangements was a real problem. And so that was able to be waived. There has been a lot of an attempt at flexibility in what is a fairly rigid non-systematic system, this private market-based arrangement. So there are some bright spots to look to.
Okay, thank you. So Jamie, what are you seeing? Are you seeing some interesting changes and innovations when you look at what's happening around the country?
So yeah, Dr. Karolak, that was really thorough of different changes that have happened. I do want to add and sort of touch on one piece of those changes, and that was this change that happened in August. As families were grappling with the reality of remote learning, the state enabled childcare programs to take in school-aged children. So essentially, kids could post up there virtually so that parents could go to work. And this sort of rightfully triggered a lot of questions and frustrations around, childcare programs are open right now, but why can't schools be? And I don't have the answer to that question, and it was a helpful policy decision from DeWine and the lead agencies. It brought needed funds to childcare programs, and it certainly helped working parents. But the larger point here, and this isn't exactly answering your question, Harvey, but the larger point here is that I think this particular policy guidance in one fell swoop really laid bare the incredible discrepancy we see between how we treat early care and education and K-12. We have a very bifurcated approach between the two in terms of how we view them, how we fund them, how we talk about them, as if early childhood learning is somehow absolutely wholly separate from K-12. It's a very artificial line that we draw where formal learning happens once a kid enters kindergarten or pre-K. And of course, we know that's not true. And we know that it's not scientific because most of the learning and growth is happening when they're much younger than that. So I wanted to just underscore that point that, hopefully now we can be talking more about this and realizing that, yes, early care and education is about care, but it's also about rich learning. And K-12 is about learning and about education, but it's also providing a basic service for families in providing care. And so if you're a teacher on this call and you've ever sort of fallen into the mindset of saying, like, I'm not a caregiver, I'm not a babysitter for children, while that is true, it's also in some ways sort of setting apart early childhood professionals who are providing care and both of these systems are providing both, because learning and caregiving are absolutely intertwined, and that's okay. Like, that's just the truth of it. So it's a big disservice to pretend that's not the case. And I'm hopeful we can kind of, and I will be looking at other states and how they're bridging those systems a little bit better, with better transitions between them and in terms of how they fund them.
Oh, those are some really excellent points. Thank you. Let's talk a bit about the impact on students. There's no doubt that COVID's impacting students. What have we seen so far with respect to academic performance, and what do we expect with academic success going forward? Talisa?
Well, thank you. Well, first, we know that in-person learning is the best learning. It's what we want. And I am not, or our team is not going to say that this remote learning is what's best for kids. It's what we have to offer to our families at this time, the safest way at this time, but it is not the best way. So with that in mind, we are expecting to see some gaps because we're not with our students. Our students are not getting the personalized attention that many of them need, but we're doing our best. Our teachers are working hard to have those creative lessons, but we know that there are going to be some gaps. And we are planning now for what next summer will look like, and some other programs that we can offer to our students to fill these gaps. We also have seen a decrease in our pre-K students, right? And it goes back to what the colleagues are talking about now. You know, what do families need? And families need childcare. So we are not seeing as many of our students, families that are sending their pre-K students to us. So we don't have that extra year to prepare our students for kindergarten. So we have to get some programs to help families with that. And we know that as we work to come back in a setting that we're more face-to-face with our students, that we would be able to close that gap. And then the last thing that we're seeing some challenges, and Katie has alluded to this as well, is Jamie, I'm sorry, is with social emotional learning. Our students, their needs are so great. When we talk about trauma, again, we've not been in face-to-face with our students since March. And for our population, we have many of our students, 6,000, roughly 6,000 of our students, who either live in foster care or homeless shelters. So we know that our students need our teachers need our students, but we want to be able to assist our families as much as possible. And in many cases, it's not about reading and mathematics and science and social studies. It's about how do we help our students with the social and emotional needs that they have now, survival skills, surviving right now, and what does that look like? And lastly, I think something that we took for granted, even when we were forced to close our doors in March, you know, we thought, wow, okay, we have to get our students their computers. We have to make sure that the learning continues. And as I stated early, that's not what our students needed. You know, they needed to know that they were going to be okay, that they're going to be cared for, that they're going to have those basic needs met. So again, our organization had to shift. We shift and we reached out to our partners. And we said, we have to tear these walls between K-12 spaces and our private and public partners, and say, how do we help our families? And we know that it's not about these academic results. And it is, you know, and unfortunately, we're doing our best, but it's not about making sure that our students are reading and writing, although we want to make sure that's happening. Our families, our mothers and fathers are not our teachers. Although we hear a lot that our families are our first teachers. As Jamie stated earlier, Families are being forced to become the teacher. So you're trying to juggle work, you're teaching math and science and supplement. And that's what our teachers went to school to do and are very good at it. And so this year is just not a normal year. COVID has just pushed us and challenged us in so many ways that getting those academic results, that is not our priority. Making sure that our students and families have what they need, and our students know that we care about them, and our staff know that we are supporting them. That's what's important for Columbus City Schools and many schools across the country at this time.
Can we go to Jamie next and talk a little bit more about this, K enrollment and being prepared for, for K through 12 and remote pre-K education? What impacts are you seeing?
Yeah, I'll just add a bit to what Dr. Dixon was saying. And I have more questions than I have answers, but we know that kindergarten enrollment, and as Dr. Dixon said, pre-K enrollment is down. That's not unique to Ohio. That's sort of happening across the board. I think I saw a figure of like 600,000 students. There are fewer kindergarten students across the country. And so there's a lot of research questions here and a lot of practical questions about what this means for teachers and their instruction in K1, 2, and 3, and the interventions they will have to implement in the coming years to make up for whatever students aren't coming in with. I also think there's practical questions about what this means for the kids themselves, whose first experience in formal learning was on a computer and maybe wasn't ideal for their learning style. So we know that even before the pandemic, in Ohio, only about 4 in 10 kindergartners showed up at the kindergarten door fully demonstrating readiness, social, emotional, literacy, and math readiness, which means that 6 in 10 weren't. And that was before all of these challenges. So again, more questions than answers, a lot to do here in terms of researching these impacts and getting really creative about the interventions that will be required.
Okay, thank you. Eric, can you add to that? What are you seeing here in Central Ohio?
I'm not going to add a whole lot to that, although I have to say I've never been prouder, I think, to be in Columbus with a leader like Dr. Dixon, and what you said about leaning into the real needs of our children in this most unusual year. Thank you so much for your leadership. Attendance is down. I'm worried about where the children are. In childcare, you always begin with safety and health. That you have to make sure these young children who really, especially different than older children, don't have the same kind of voice, are safe, and that their health is being well taken care of. And that brain building that occurs that is so elemental to childcare and early learning programs, that's important too. But if you're not in the program, it's very hard to make sure any of that is happening. And here in Central Ohio, we've had very uneven enrollment throughout the pandemic. Our data we've been tracking since April has been very up and down and sluggish. And in our most recent data collection, 54% of the enrollment in programs is at 54% of capacity, which makes you wonder, where are the rest of the children? And if our number one question, I was in a campaign a long time ago where this was the slogan, if the number one question is it good for children? You got to know where they are in the first place. And so I have a lot of concerns, to Jamie's point, questions about what's happening in the background, and making sure that those health and safety concerns, and of course the other basic needs, are being met. And so that's all I would add.
Okay, good points as well. So we have a lot of good questions from the audience. So I'm going to turn it over to Katie and let her field some questions for the panel.
Yeah, it's going to be hard to choose between them. They're all so great. Okay, first question. What lessons are to be learned from the two truths we are seeing? Our students are getting into much less trouble in school as they attend in hybrid mode, but they also speak a lot less with masks on, whether addressing their peers or participating in class. Are they just shutting down, or are they being more mature and better behaved for good reasons?
Wow, I don't know how to answer that. I think, we're challenged by the context. So for example, I stated to our team that this could be a year that we could potentially get disengaged students back engaged with schools. Because there was a lot of research that talked about the high school dropout, right? Students drop out of schools because they're not engaged. They don't have teachers they like, they don't have students they like. But now we're behind this computer, right? So I can engage a student in a very different way, and I don't have to be a person, right? I can just give your assignments and you can go at it and get your, get your grades, get your diploma, and be successful. But then you have those students that are like me, that are most social. I'm a social being. And then right now, even when I am in my office, I put my mask on and I go stand in the doorway of a colleague because I have to do it safely. So I think students are adapting to this new way of learning and being in school. And are they behaving better? I don't know how to answer that. I think it's all new for them, and they're challenged by this. I just think just having our students on Zoom or whatever platform and have them engaged with their teachers and their colleagues and their students at any point, I think is good. And we in our organization we're defining, what does engagement look like, right? Is it logging on every day and having a conversation with the teachers or doing work? Or is it that student that just sits and does absolutely nothing, but you see his face, he doesn't quite know how to manipulate all of this technology. But I think that's a tough question. But I think our students are responding. And there's a lot of more professional development we can do with our teachers to get them more engaged with students who love this online platform, and vice versa. I think our students are telling us there are too many platforms for them to manipulate. And they are challenged. They want to say, hey, can you just give us one platform for all of our classes? And so we're working through that too. How do we make sure that students have the development that they need to master the technology? So I hope that answered that question for that person.
All right, a couple of people have this question asking, are there any strategies to address the childcare teacher shortage that we are currently experiencing?
Boy, that is a tough one, and something that long predates the pandemic. In Central Ohio, where we've had the luxury of a very strong economy, even a year ago, staffing shortages were a significant issue. That step up to quality, state quality rating and improvement system deadline, we encountered programs that would meet the requirement and then lose it because their staff would change, and the staff they had didn't have then the necessary qualifications to meet the step up goal. And so that's been a problem all along. And right now in the pandemic, it's exacerbated by the changing rules around around requirements for providing pandemic care, if a program is still choosing to do that. And it's been exacerbated by the generous unemployment benefits, so important for keeping families whole, that have made it a little bit more challenging for an individual to choose the field as opposed to not. Our wages continue to be terrible, and that is the biggest barrier in terms of attracting a skilled, qualified workforce and investing in it on an ongoing basis. So the problem is severe. In terms of possibilities, there have been some innovations in Central Ohio specifically. Ohio State has partnered with the city, local governments, and Columbus State and Action for Children to create a early childhood educator preparation pipeline, I think is the actual phrasing of it. And for a number of years, that was producing bachelor degree teachers who could then enter into early childhood settings. But at its core, this is a labor market issue. And until wages, compensation in our field increases, it will be very difficult to be competitive. We just ran focus groups with childcare providers who were explaining how they lose employees to Burger King and McDonald's. It's not surprising. The average income of a childcare worker is $22,200, and that's what a fast food cook's income is. So that's the fundamental issue that needs to be addressed.
I would just add to that too, me and my cat Bodie. I think we could spend probably a whole webinar talking about wage issues and teacher retention. There's two efforts I would just draw to your attention. One is that in California, home childcare providers voted to unionize this year. And I know there are other efforts underway across the country to unionize and really strengthen that sector of the workforce. And those are worth learning from. The second is that on Tuesday, Oregon's ballot issue, it's the county where Portland is. I forget the name of the county, but they passed a tax levy to fund universal preschool for 3 and 4 year olds, as well as raise teacher pay. So there are examples. This is kind of the beauty of federalism. We can look to other cities and states and try to learn from them that are, being more active on addressing this issue. And as Dr. Karolak mentioned, there's good stuff happening in Ohio too, but wanted to highlight those.
Awesome. Next question is, some suburban school districts, example Dublin and Upper Arlington, are doing hybrid models. What is Columbus City School reasoning for not doing hybrid models? Will that increase achievement gaps since distant learning is not the best mode for learning?
Thank you. That's a good question, and one that many people have been asking. It's like, everyone is back, Superintendent. Why isn't Columbus back? Well, I've stated many times that we're a more complicated organization than our suburban colleagues. For example, although we have, roughly 50,000 students, we have almost 10,000 employees. Plus, we have another 13,000 students that we transport from charter non-publics. So you think about the number of people under our care that we have to make sure that can come to school safely. We're transporting those students safely. We've been transporting, our charter non-public since the beginning of the school year. And we have various guidelines now with COVID. So for example, transporting students, 50,000 students, you cannot transport 50,000 students on a bus when you have guidelines that have moved from one student every other seat to one student per seat. There's no way. We don't have enough buses to be able to transport our students in that way, and to transport our charter non-public students who are back in school 5 days a week. So we're challenged by with transportation and transporting our students safely. And also remember, we are an open enroll district. So our students and families have the opportunity to attend whatever school that they would like. But for some students, that will call for them to be on a school bus 30, 40, sometimes an hour. So again, those COVID guidelines are stating that students should be on a to be on a bus, wearing a mask, social distance, and in many cases, you shouldn't be on it more than 15 to 20 minutes. So transportation is something that we are working through. Also, we have staff members. Our teachers have to be comfortable coming to school. We have teachers and administrators that may have challenges with COVID, et cetera, or they may have family members that they need to take care of, or even their own health challenges. And we don't want, if we don't have enough teachers to be in front of our students, then we have a gap there. And I think it was one of the questions that were asked in the chat, that teachers are not feeling valued. They are feeling that they are being called to come to the front line during this pandemic. And I stated to that person that if we're doing that in Columbus City Schools, please let's sit down and have a conversation, because we don't want our teachers to not feel valued. However, we know that our teachers are critical to our students returning. So it's complex. There's a lot of moving parts for Columbus City Schools. We are working now to bring our students back safely in the spring. We brought our career and technical education students started Monday because they need special industry credentials to get their credits. And so they are back with us. But we also are working on a plan to get our other students, our remaining students, back in the spring. So we are working on it. There, again, a lot of moving parts, but we do want our students to come back in our buildings, all 109 buildings, all 50,000 students, safely. And we also want to make sure that we have our staff that are ready to and feel comfortable coming back into our school buildings as well. And our families, and making sure our families feel comfortable sending our students. We have about 3,000 students who are in our digital academy. So 3,000, about 3,500 students are in our digital academy. So those families felt that, yes, Columbus City Schools, we're committed to you, but not during COVID. So we are going to remain in this online learning platform for the entire school year. So, we wanted to give our families as many choices as possible. And as we are learning from our health, Columbus public health officials, we're learning now that there are safer ways that you can bring your students back as we see a growing number of cases. And so we're learning that, but we also understand that we have to do a better job making sure that what we're hearing from our health officials and students returning, that their families feel comfortable seeing a rising number of cases and sending their students back to school. So it's very complex. I know there was a lot, but there are a lot of moving parts, and we are working diligently to bring our students and staff back in a blended learning mode safely.
Okay, thank you for those answers, and thank you for those great questions, audience. I want to now wrap up. We're running out of time with a final question to the panel, and this will be real quick, kind of take-home message from each panelist. So now we're hopefully woke to the risk of pandemics and other shocks in the future. We now live in an era of pandemics, and there may be other shocks such as with climate change, extreme storms, heat stress, other things that are going to impact our children and their education. What is the message moving forward? What is the lesson we should learn moving forward to make our childcare and K-12 education systems more resilient? Let's start with Lisa.
Oh, I think Jamie alluded to it earlier. It's equity. When we talk about what does equity mean, for us, it means removing all barriers, all barriers. For some, they said level setting. No, it's removing the barriers. What barriers do students have that prevents them from having a quality education? And what we have to make sure is that we remove those. If it's financial, if it's just staffing, whatever those barriers are, let's reach across the aisle and get this work done. We have to move out of our silos and say our families need help, our students need assistance. What will it take to get it done so we don't have health disparities? We don't have this gap with technology. Our students need us, and it starts here in our schools. It starts with our earlier students, as we know, but removing those barriers.
Okay, Eric, 1 minute.
Yeah, that solutions focus is so essential, and equity is the right place to frame it. Unfortunately, when it comes to childcare and early learning, the first barrier is that your access to that too much depends on the income of the family, on your zip code, basically, and that only accentuates, perpetuates racial, gender, other class, other systems of oppression that have kept folks from moving forward. So the faster we get to an understanding that childcare and early learning is infrastructure. It's necessary for work just like schools and roads are. The faster we'll make children better prepared for school, and that schools can meet the challenge of the 21st century.
Okay, thank you. And Jamie, wrap it up for us. Tell us how to move forward with a more resilient system.
No pressure. I think crises really force us to pause and consider what truly matters. And so we see this happening. As Dr. Dixon mentioned, we see a move away from standardized testing and towards talking about social emotional skills and mental health and Maslow's hierarchy of needs. I think COVID has brought us a reckoning. It's forced us to come to terms with the fact that basic safety and wellness is a prerequisite for learning. And I also think it's shown us where there are vital skills and background knowledge that are missing. I don't know about you all, but I've even questioned this for my own family. Like, I need my kids to be able to do their own laundry and help the family as a functioning unit and have more life skills. And a better example than just laundry would be, why haven't we as a society done better prioritizing social justice education? Why do we have so much ignorance about race and the history of racism in this country? Is the education that we're providing to our children in schools and in our homes, is it equipping them to care about the collective? I think a pandemic tragically and sort of perfectly showcases how well we have empathy for other people, how well we can make sacrifices for the health of the whole. And quite frankly, I don't think we're doing a very good job of it. So I think we can tweak all of these systems and make policy improvements, but until we get real with ourselves about what is most important for our children to learn, what skills, what civic values do we want them to have, I don't know how we'll buffer against future crises.
Excellent. Thank you for that very important point. Very well said. And I want to thank all the panelists for this has been a great discussion about something that's just essential for our community and essential for the future of our community. So thank you all for your time and your insights today. And everyone, join us again on November 30th at noon for Economic Impact of COVID on Communities Part 2. And in the meantime, stay safe, stay healthy, and remember, we're all one. Thank you. Have a good weekend.